Let's be real. This is the one question men don't like to ask out loud. Not to their friends, not to their doctor, and definitely not in public, but they still think about it all the time. Can you actually make your penis bigger? Is it even possible, or just another internet scam? If you've ever searched for answers, you've probably run into bold claims, sketchy devices, and miracle pills. Some people promise inches in a week, others sell tools that look like torture equipment. It's confusing, overwhelming, and honestly, a little desperate. But today, we're going to sort the truth from the noise, because for once, you deserve a straight answer. We're diving deep into what science actually says about penis enlargement, what works, what doesn't, and what might leave you worse off than when you started. And if you stay until the end, I'll tell you the only method that has shown real, measurable results. Let's get into it. First, let's start with what the data actually tells us. Most men who worry about the size of their penis, they're within the normal range. A massive global survey involving over 50,000 men found that 55% felt insecure about their penis size. But here's the twist. When their partners were asked, 85% said they were satisfied with how things looked and worked. So the problem isn't usually physical, it's psychological. The average erect penis is about 5.2 inches, 13.2 centimeters long. Anything between 4 and 6 inches is considered completely normal. Only a very small number of men, less than 0.2%, have what's medically called a micropenis, defined as less than 2.9 inches, 7.5 centimeters. So why do so many guys think they're too small? Blame porn, social media, and locker room myths. Constant comparison to unrealistic images creates warped expectations. This leads to a condition known as small penis anxiety, where men obsess over size even though they fall within the normal range. So, what can actually be done? Can you increase your size, or are all these products and procedures just clever marketing? Let's separate the science from the scams. We can divide penis enlargement options into two main categories: non surgical and surgical. Let's start with non surgical options. 1. Psychological counseling. This may sound unrelated, but for many men, it's the most powerful solution. When people work with a therapist who specializes in body image, the vast majority come out the other side feeling confident without needing any physical changes. In studies, men who receive counseling often decided not to pursue any procedures afterward. That's huge. Why? Because they realized their body wasn't broken, just their mindset was. If you're spending more than an hour a day thinking about your size or avoiding intimacy because of it, consider therapy as your first step. Second, penis extenders, traction devices. Among all the physical methods, this is the only one that has shown consistent results in clinical data. These devices gently stretch the penis over time, applying mechanical tension for several hours each day, often for several months. Let's be clear, this is not a quick fix, but in studies, users who were consistent, wearing the device daily, saw an average increase of 1.5 to 2 centimeters in flaccid and stretched length. Some users even reported improved erection quality due to better blood flow. But there are caveats. It requires discipline and patience. We're talking 3 to 6 hours per day over 3 to 6 months. Some users report discomfort, skin irritation, bruising, or numbness. Gains are generally modest, not dramatic. That said, for men who want small, safe improvements, this is one of the few options with real backing. 3. Vacuum pumps. These are often marketed as penis enlargers, but their main use is to temporarily draw blood into the penis and help with erections. Yes, they can create the appearance of size, but only temporarily. As soon as blood flow returns to normal, the effect fades. They're useful for erectile dysfunction, but not for permanent enlargement. 4. Injections. Now we're entering dangerous territory. Some providers offer cosmetic injections using fillers, fat, or silicone to add girth. Sounds tempting, but these are not approved for this purpose by most medical boards. The risks: hard lumps, pain infections, deformity, erectile dysfunction complications that can appear years later. In some reported cases, the filler migrated through the body, causing long-term damage. Bottom line, don't inject anything into your penis, ever. 5. Supplements and pills. You've seen the ads. Gain 3 inches in 2 weeks. Let's be clear, no supplement can increase penis size. Some may improve blood flow and temporarily help with erections, but they don't affect actual length or girth. Many of these products are unregulated and can contain hidden drugs or dangerous ingredients. Save your money. Now, let's talk about surgery. Yes, surgical enlargement exists, but it's complicated and risky. The most common surgical method is cutting the suspensory ligament, which holds the penis close to the pubic bone. When cut, some of the hidden internal length becomes visible. Sounds promising, but the results often disappoint. The penis may appear longer when flaccid, but not during erection, and it may hang at an unnatural angle. Other surgical options include fat injections or grafts to increase girth, skin flaps, cartilage implants, use of prosthetic materials. But here's the problem. These procedures carry a high risk of complications such as infection, scar tissue, loss of sensation, erectile dysfunction, poor cosmetic outcomes. And even worse, many men report no improvement in confidence or sexual satisfaction after surgery. In fact, regret is common. That's why reputable urologists don't recommend these procedures unless they're part of a clinical trial. A clinical trial means the procedure is approved and monitored by a medical ethics board. Every complication is recorded. You're protected by protocols and supervision. Outside of that setting, you're gambling with your health. Surgery should be a last resort and only for those with serious medical issues, not normal anatomy and anxiety. So, where does that leave us? Here's the truth, as simple as it gets. If you have a medically normal penis, you probably don't need to change it. And most of the methods claiming to help either don't work or are dangerous. The only non-surgical option backed by data is a traction device, and even that only gives small results with lots of time and consistency. Everything else, either unproven, risky, or flat out harmful. But the real solution for most men isn't physical, it's psychological. Understanding what's normal, learning to let go of harmful expectations, and realizing your value doesn't come from a ruler. Take care of your health, protect your body, and don't fall for promises that sound too good to be true. Because the truth is, you're already enough.